Hello, this is a presentation by
Ezekiel Nwakwue.
Brianna Moore.
and Patrick Shapland on new technologies assisting with birth control.
There are currently more than the basic three forms of female birth control. Now there are three different types of pills. You have a vaginal ring, a diaphragm, an IUD, a female condom, a patch, an implant, sterilization, emergency contraception, microchips. Those are all current methods.
Let me give you a little bit of an introduction of birth control. Birth control pills and traditional latest condoms have been in use for decades, and health organizations and forward-thinking companies are making efforts in trying to produce new ones. It is believed that 62 million women in US use contraceptive, and the most popular among them is the pill. Bill and Melinda Gates Foundation funds FHI 360, and this is an injectable contraceptive that will last for 6 months, and setting stage for the new birth control technology.
When it comes to male forms of birth control, there are not many options. In fact, there are only two: condoms and vasectomy.
From this graph, you can see the contraceptive methods used by the U.S., ages 15 to 44 in the years 2006 to 2008. From this, you can see that the pill, female sterilization, male condom, and vasectomy are the top used. That is because these are the most effective methods on the market.
Birth control options for your teenage daughter. There are many methods of birth control, but not all are ideal for teenagers. According to CDC, each method has its pros and cons. Pills are one of the most popular form of birth control because they are effective, convenient, safe to use, and easy to obtain with prescription. Women take one pill each day, which delivers hormones that prevent eggs from leaving the ovaries and makes cervical mucus thicker, which keeps sperm from getting to the eggs. Combination hormone pills contain both estrogen and progestin. Some are progestin-only pills. Other birth control options used in the past are through shots and ring. Birth control shot Depo-Provera is good for women who do not like to take pills. This is injected once every 3 months. Another option is the vaginal ring, Nuva ring, and this is used for 3 weeks every month. These options are replaced with the new invention. Here are the 5 innovative ways we are reinventing birth control. Microchipped remote control contraceptive, origami condoms, L condoms, cyno implant, and the diaphragm. Microchips is replacing pills, patches, and IUD. This was introduced by MIT in Massachusetts. It delivers drugs beneath your skin, including hormonal birth control. According to my research, this is viable for women in the developing countries. Microchips got approval from FDA for pretrial in 2015, and it will be put in the market in 2018. Origami condom is another form of birth control. It does not roll or fold back, and it is made of soft, flexible, and durable silicone material. It slips on instantly as opposed to latex condom. It is designed for men and women. Sexual experience feels natural. This one too was funded by Bill Gates Foundation and to hit the market in 2015. A condom is another form of birth control. L is trying to reinvent the traditional condom from the start by changing the way it is manufactured and marketed. The intention is to remove the irritating additives associated with it. L was founded by Talia Franco after documenting human rights issues for the United Nations. Sino implant is another form of birth control. This is affordable pseudomall implant made of two thin, flexible rods containing levonorgestrel, specially made for women in developing countries. It is registered in more than 20 countries. It cost about $20 in 2010, but today it is sold at $8 per unit. The final form of birth control is curvature diaphragm, formerly 6. This is a reusable form of birth control. It is also affordable. Because of its discomfort, it is rarely included in family planning. It is used to deliver gels that can prevent HIV and STIs. This was approved by FDA on September 9, 2014.
New forms of birth control for women consist of contraceptive gels, contraceptive rings, telemedicine, microchips. These are all new and future forms of birth control for women. Researchers at the Population Council are developing a contraceptive gel for females. The gel contains both nesterone, a form of progestin, and estradiol, a form of estrogen, the same as the estrogen made in a woman's body. It's applied to and absorbed through the skin, designed to suppress ovulation. Phase 1 and 2 clinical trials have already been conducted in Chile, the Dominican Republic, and the US, and future Phase 3 studies are in the works for both the US. Researchers are working on other 2-in-1 options, including a team at Northwestern University. They're currently testing a contraceptive in women that's similar to the current NuvaRing, a ring put into the vagina that uses hormones to prevent pregnancy. It releases antiretroviral drug to inhibit HIV and herpes. It should be removed after 3 weeks of insertion. Contraceptive ring. Instructions for insertion of the contraceptive ring. 1. Hold the ring between your thumb and index finger and press the sides of the ring together. See figure to the right. 2. Insert the folded ring into your vagina and gently push it further up into your vagina using your index finger. See figure to the left. 3. When you insert ring, it may be in a different position in your vagina, but ring does not have to be in an exact position for it to work. 4. Ring may be moved around slightly within your vagina. This is normal, although some women may be aware of ring in the vagina. Most women do not feel it when it is in place. Planned Parenthood recently began offering online health services for birth control and STD testing. Patients are able to converse with the provider face to face through a secure video consultation system. They're also able to request birth control or an STD test kit and treatment in the mail. So far, the program is only available in Minnesota and Washington state. It is called telemedicine.
A male condom is a thin covering that goes over the penis. They can be made of latex, polyurethane, which is plastic and the best alternative for those who are allergic to latex. They can also be made of lambskin. Condoms prevent pregnancy as well as sexually transmitted infections. A vasectomy is a small procedure that makes a man permanently unable to impregnate a woman. The procedure prevents the release of sperm when a man ejaculates. During a vasectomy, an incision is made in the scrotum. Then the two vas deferens are cut or tied, and the ends are sealed off. Once the ends are sealed, the vas deferens are placed back inside of the scrotum, and the male is stitched up. This prevents the sperm from mixing with the semen. A woman cannot get pregnant with just semen. The testicle will continue to produce sperm, but it will be reabsorbed by the body instead of ejaculated. Even though nothing new has been offered in terms of male birth control, there are a few methods that are in production. One method is Vasogel. This is a polymer hydrogel that is injected into the vas deferens. The gel fills the tubes and nests itself along the walls. The sperm cells are too big to pass through the barrier that this gel has created and is therefore reabsorbed by the body. This would be a good alternative to a vasectomy because it can be reversed. When a man decides he wants to reproduce, the gel would be flushed out. There are a few other products like this in other countries, but as of now, nothing like this is available in the United States. Clean sheet pills is a non-hormonal pill that would stop the muscles that help produce semen and sperm. This would eliminate ejaculation altogether, but the male will still be able to experience orgasms. A benefit to this method is that research shows that it may reduce the transmission of HIV from males to their sexual partners.
Another contraceptive for males currently being researched is hormonal pills. Currently, there is no contraceptive pill for males to take, but recently there has been an article published in the journal Science about a study conducted in Japan where they worked to block a sperm-producing protein in mice. The protein that they targeted is called calcineurin. After this protein was suppressed in the mice, their sperm was no longer flexible enough to impregnate the females. The most promising part of this research was that after about a week of being off the drug, their fertility returned. So far, this research is just a proof of concept, as the side effects included a weakness of the immune system and therefore isn't a viable solution. This research is likely years or even decades away from human clinical trials, but this does show the progress being made in hormone and protein suppression research as a male contraceptive. In conclusion, there are new technologies and innovations being made to contraceptive techniques currently used. Diaphragms are being improved in ease of use, comfort, and reusability. Condoms are being made stronger and with less irritants. Telemedicine is allowing more and more people to get in contact with doctors in order to assess their contraceptive needs. New innovations in the field of contraceptives for females are microchips, contraceptive gels, contraceptive rings, and cyno implants. All use a progesterone-like hormone to thicken the mucus in the neck of the womb so it is harder for the sperm to reach the egg. Differences include microchips are inserted under the skin and can last up to 16 years. Contraceptive gels need to be applied for a few days every month. Contraceptive rings are inserted vaginally and need to be removed every 3 weeks and then replaced shortly after. The cyno implant is inserted under the skin and can last up to 3 years. Innovations for male contraceptives are hormonal pills, non-hormonal pills, and vasogel. The differences being that hormonal pills render the sperm ineffective. Non-hormonal pills prevent the muscles from ejaculating, and vasogel prevents ejaculation by blocking the sperm in the vas deferens. Thank you for watching our presentation on New Technologies Assisting with Birth Control. Here you can see our references for our presentation. Please feel free to check these out and post in the comments section below any thoughts and opinions.